Okay. All right. Is Kimberly on? Kimberly Moss on?
She's coming in now.
Okay. There she is. There's Kimberly. All right. Good morning. So today is Monday, June 29th. This Committee of Health and Human Services is called to order. I'm going to ask Ms. Kimberly Moss if she can read the roll. Ms. Moss?
Griffin,
Here.
McCormick,
Present.
Conwell, Hairston,
Here.
Bashir Jones,
Here.
Santana,
Present.
Zone.
Present.
Mr. Chairman, you have a quorum.
All right, thank you so much. I'm going to read the disclosure and basically this Health and Human Services Committee hearing is being held during the COVID-19 emergency declaration in accordance with Ohio's open media laws as amended by subsection House Bill 197. This meeting is being held using the Zoom platform and is being live streamed on YouTube and on Cleveland's Channel 20. It can also be seen on the Cleveland City Council website and from Council's Facebook page. In accordance with open media meetings regulations as amended by sub HB 197, notice of this committee hearing was publicly posted. I will give a brief overview on how the virtual meeting will be conducted. The committee hearing will be conducted as all committee hearings in accordance with Robert's Rules of Order. The chair will facilitate the meeting and call on persons to speak. If you wish to speak, please use the raise your hand option in Zoom. Please limit your comments to the matters before today's committee. As is the usual practice, any actions to be voted on during the committee will be done by voice vote, called and recorded by the committee clerk. The following meeting held during the COVID-19 emergency declaration will be conducted as virtual meetings in accordance with Ohio's open meeting laws as amended by SB 197. The public may observe these meetings on YouTube and Cleveland Channel 20. For more information, go to Cleveland City Council's website. Today we have with us the Director of Public Health, and I also see the Chief of Public Affairs. Director of Health is Merle Gordon, Chief Public Affairs, Natoya Walker-Minor, and we're going to receive an update on COVID-19. Before I proceed on receiving an update, I do want to say that I had the opportunity to go and visit Merle, Director Gordon and her team yesterday while they were doing contact tracing and really get an understanding of the process. And one of the things that I've noticed that I want to thank those frontline workers is that they've been working 7 days a week since probably the early part of March. So Director Gordon, before I proceed any further, I just want you and your team, especially like Katie Romig, who is the epidemiologist, who really gave me a good understanding of how you guys operate along with yourself yesterday, and your entire team that's been working on this COVID-19, as well as Commissioner Persis Sosiak. Sorry, I didn't see you earlier, Commissioner Persis Sosiak. So thank you guys for the work you've been doing. And that being said, I'm going to ask all my colleagues, Merle has a thorough presentation for us. Please save your questions until after the presentation, and then I will proceed to call on anyone who has questions. Thank you, and Merle, you have the floor.
Okay, great. Thank you, everyone. Thank you, Councilman. Really appreciate that very much, and the team will very much appreciate that as well. All right, so the last time we formally presented was March 12th of 2020, which quite honestly seems like a million years ago. Chief Walker-Minor and I and Commissioner Sosiak will be presenting this morning. So we'll start very briefly. Can you see my screen?
Yes.
Okay, great. So what is COVID-19? COVID-19 is an infection caused by a virus called coronavirus. It's part of a family of viruses that are commonly found in animal species It's now thriving in a human host and continues to perplex us all, and is not behaving like influenza or the flu, which the COVID continues to be very pervasive in our community. The reason why it's COVID-19, as you see on the bottom, is the CO is for corona, VI means virus, D is disease, and it was identified in 2019. How is it spread? As we've talked many times before, it's spread amongst close contacts through respiratory droplets from the mouth and nose, and can land somehow back in the mouth or nose of another human host. Additionally, it can be transmitted through contaminated surfaces if you touch it, even on your hands or on gloves, and then touch your face, your eyes, your nose, or the virus can spread into your mouth. This is just a depiction here of just a sneeze, how far droplets can go, and how much can come out of, how much the virus and droplets can come out of the mouth. So what are the symptoms? The symptoms are very similar to the flu and can include a new sense of the loss of smell and taste. Symptoms do appear approximately 2 to 14 days after exposure, and illnesses have ranged from very, very mild, almost asymptomatic, to very severe, which have landed people in the hospital for upwards of a month, 2 months, even more. I just wanted to share very quickly the 10 essential public health services. This is what health departments do every day and have been doing for centuries. And the reason why I share this with you is so that you have an understanding of all of these components of public health, and really what we as the health department and every other health department in this country and around this planet really are doing around this COVID-19 work. So as we do all of our work, one of the bigger things that we are also doing is incorporating evaluations. So we are even surveying individuals after they've worked with us, positive cases, so that we can continue to be better and make sure that we are reaching the community and providing public health. So some of the major responsibilities for this work is around epidemiology. So we are really managing the incidence, the distribution, controlling of this infectious and contaminated, this disease. The surveillance is around all of the data that we are collecting and interpreting and putting out to the community. Emergency preparedness is a big component of this work and is helping us with coordinating amongst many, many, many agencies. Obviously prevention, so that we're educating the community, and we'll talk a little bit more about some of the innovative prevention methods that we've been employing here as we know more and more about where outbreaks are occurring. And then enforcement and education as we try to keep up with the ever-changing orders from the state and how those impact all of our businesses and our communities and individuals. So another big part of our work is, again, infection control and case investigation. We also spend so much time providing guidance to local businesses and organizations, both based on the state orders, but also on just good infection control and ways that they can mitigate risk within their organizations. We field so many concerns, again, around the stay home order, what distancing means, essential, non-essential, how we get reports of masks not being worn in certain operations. Mass gatherings, which right now is, I'm sure, quite confusing. If we can have 300 people at a wedding, but you can't have more than 10 people at a meeting. And then when individuals and organizations are not following the ODH orders. We also do a tremendous amount of coordination with Cleveland Police and the Ohio Department of Public Safety on the complaints that come into our department. So the team, as Councilman Griffin explained, we are doing this 7 days a week. We have been since very early March. We have a situation room and central operations where primary players are me, the health director, Percy Sosiak, the health commissioner, Katie Romig, our chief epidemiologist, our emergency preparedness coordinators, and then we have a group of 2 leaders on contact tracing who really help with the volunteers and the teams doing the contact tracing, and then the contact tracers. Additionally, Chief of Public Affairs Natoya Walker-Miner has played a key role in this work. Also, Dr. Lynn Milliner, who is our medical director. She's actually a physician at Metro Health, but she has been doing so much with us over this period of time. And then the rest are epidemiology, emergency preparedness, our director of nursing and all of our nurses, our communications officer, Healthy Cleveland, Office of Minority Health. The commissioners of air quality and environment have been intimately involved with a lot of the complaint mitigation and investigation work, and all of their staff as well. Deputy Commissioner of Environment has played a critical role in this, as is the Chief of Air Pollution Outreach. All of these people deserve so much credit for how much they have just pitched in, stepped in, and really assisted with this work. Our other partners, the City of Cleveland, again, include public safety. EMS has been a critical partner along with Cleveland Police. Emergency management, we've been in lockstep with them. And then also a big shout out to the Water Department, who's loaned us an individual who's been helping us with GIS mapping and the dashboard that's on our website that we'll talk about in a minute. Our national partners are the CDC and HHS, along with the Big Cities Health Coalition. All of our data gets uploaded and sent to the CDC through the Ohio Department of Health. So all of our data gets compiled for the national picture. Our state partners include, of course, the governor and other state agencies, including Medicaid, Department of Aging. The Ohio Department of Health and the Ohio National Guard have been critical. I think we talk to them at least the Ohio Department of Health multiple times a day. The National Guard we'll get to in a minute as well in terms of their work here. And then the Association of Ohio Health Commissioners, as we're all learning from each other and how to continue to move forward. I'd be remiss if I didn't also just really thank so much my colleague, Director Mary McNamara, who's been an immense support and partner with this. Additionally, we've got Cuyahoga County Board of Health and Cuyahoga County government, all the other local health departments around the state and the country. Our hospital systems have been an enormous help with this work. And then our community clinics and FQHCs, health and human service organizations, the food bank, and child care centers, ODJFS. There's so many to name, but they've all been, we've been working with them constantly over the last 4 months. To start getting into a little bit more of the details now, the primary response work includes working through each positive case. All labs upload positive results into the Ohio Disease Reporting System. We then pull off that system, those cases, and begin the process of identifying each confirmed positive or index case, calling to interview them about their possible exposure to others. They are issued isolation orders where they are required to stay isolated from others to prevent infection. And we also provide them a kit of helpful information for themselves and their families. We then also ask them about close contacts and begin what's called contact tracing, which we'll explain in a minute. CDPH staff and volunteers conduct regular wellness checks by calling the index case every couple days. After approximately 10 days after symptom onset and 72 hours symptom-free, without the aid of aspirin or some pain reliever, we then issue them a release from isolation letter and let them resume their regular lives, minding all public health guidance. Cases can be very complex depending on where each index case was last when symptomatic. Often cases require a tremendous amount of triaging, working with employers, agencies, congregant living facilities. It can be restaurants, it can be airports, it can be businesses, it can be anywhere, to assist them in both identifying who may be at risk and how to employ infectious disease control measures within their operations. Outbreaks are when multiple cases arise from the same source facility, and I include 2 or more positives. We maintain and report data to the state and also to CCBH, who reports out on the impact of the entire county each week. The hospitals play critical roles. We often are working with their infection control personnel and all their efforts around COVID response and working on each case. Next slide. So the long-term care and nursing homes, as you know, some of the most complex cases have been residents of long-term care facilities, and many of, unfortunately, the deaths. Some of the most vulnerable to COVID-19 are residents of long-term care facilities, since they were ordered to close to all visitors, and many continue to experience positive cases and outbreaks. The governor issued orders recently requiring all staff to be tested. The Ohio National Guard and local hospital partners have been testing all of the staff of all of the long-term care facilities. While it's surprising that the positivity rate remains quite low, between 1% and 3%, it is still a critical intervention for these residents. In terms of communications to the community, this has been primarily led by Mayor Jackson and the Mayor's Office of Communication by providing regular updates and town hall sessions. CDPH continues to provide as much information as possible on our website and social media, and keeping the dashboard updated daily. And if you haven't looked at our website, which is www.clevelandhealth.org, if you click on it, each day you will see an updated dashboard. This is the first half of it. The other half is on the next slide. It is a bit busy, but we're trying to put as much information on here as possible for you to understand where our cases are and the demographics of our cases. We include our death data and our, again, demographic and race and ethnic breakdown on our dashboard. And we continue to take input from the community of how best we can represent. If there are other recommendations, please let me know so that we can continue to make sure that this is useful for all. Underneath the map, you see that you can click on it, it's interactive. The disclaimer, the sources, and the data definitions are all listed there, so it can explain if you have any questions on the dashboard. I encourage you to click on that. And additionally, underneath the Cleveland confirmed and probable cases, where it's been tracking all of our cases since March, we include Cleveland, Cuyahoga County, and Ohio cases there as well. So it's all on one, site. Then additionally, this is the second half of the slide. I guess it's a little bit bigger for you to see, again, the disclaimer, and then how we have all of the additional cases for Cuyahoga County and Ohio. This was pulled Friday, the 26th. We had a very, very heavy weekend of cases. So today you will see that these numbers have gone up by over 100 over the last 2 days. I'm now going to turn it over to Commissioner Persis-Sosiak, who will take over and talk through the contact tracing and a number of other issues as well. Persis, I'll advance the slides when you need.
Okay, thank you, Director. Everyone, good morning. Good morning to the members of City Council and to members of the public who might be joining us virtually. Again, my name is Persis Sosiak. I'm a commissioner with the Cleveland Department of Public Health. So by way of a little bit of background, CDPH has been investigating and working with travelers returning from international destinations since early 2020, January, February. We first learned of individuals via the ODH, via the CDC, and they were largely coming back from Asia, specifically from China. You may recall that this was during the time of the Lunar New Year celebrations. So many families gather to celebrate and to be together. So we started monitoring those individuals again in early 2020. Looking back on that, it does seem like it was another lifetime ago. Some of our challenges at that time were just reaching out to the individuals. Often they did not speak English as a first language, so we had to work through the language line, which has since become a lifeline for us, really. We also had to, in some instances, procure thermometers and then drop those off at individuals' homes because that was a requirement that we had to do a daily check-in as well as daily temperature checks. So again, that seemed like a lot, and obviously now it's just multiplied. So as of Friday, like Director said, we're over 2,000 cases, and we have 473 probables. Well over 900 individuals have been released from isolation, so approaching half of our total caseload, and we have had 74 deaths, quite unfortunately. So next slide, please. When we first learn about that case, it comes into what we call ODRS. Some people call it ODRS. That stands for the Ohio Disease Reporting System. Every communicable disease that is reportable in the state of Ohio comes through that system. So the staff at CDPH are very familiar with that system and do work in it daily. However, since COVID, it has become, it's expanding massively, obviously, to account for all the COVID cases. So once we learn of that case, we first have to also then check to make sure that they are indeed City of Cleveland residents. We make sure that it is a true case based on the laboratory results, and then we deploy it for contact tracing. So the screen or the slide you're seeing now is actually a table that shows some of the questions that we need to ask and some of the data that we need to collect. So the left-hand side are the actual questions that we're asking or the topics that we're covering. And then the right-hand column shows what we are hoping to obtain from that interview and that individual. As you can imagine, this kind of runs the gamut of interactions. So some people have not yet heard that they've tested positive. So we are their first notification, which again, as you can imagine, could be challenging to that person. Some individuals are hospitalized, so we are unable to speak with them. Some of them aren't able to speak with us just because of their other medical conditions or their what they're experiencing in their lives. Others are reluctant or hang up on us. So I guess the perfect, if you can say that in the era of COVID, is the individual who's very willing to speak with us, who shares very candidly where they've been, what they've been doing, and that really helps us so that we can start painting a picture of what that infection or that infectious period looks like so that we can prevent. Next slide, please. So we like to show this picture of concentric circles to help us really describe why we are tracing and what it really looks like. So that very inner circle where that very tiny dot is represents the patient. We also often refer to that as the index case. Where we have next, the greatest worry, the most concern are what we call the close contacts. That's the next circle when we're working out from the center. So that would be the members of your family or the people that live with you. It might also be the people if you take care of individuals, be them young, very young, or elders. We also are worried about intimate contacts. And the reason those close contacts are of greatest concern is that we know that the virus, we have the most greatest ability to transmit to others when we are closer than 6 feet for more than 15 minutes. So the three groups that I mentioned, we could certainly have that, that type of contact. And those are the individuals that we then want to place in quarantine. So the final circle, or what we call extended contacts, that might be work. We recognize some of these other groupings have been largely suspended, but it's that next group of people that you might be spending time with throughout your day to day. And before we move on, I will just say that for those individuals that we are speaking, when we're speaking to the index case, we are then asking them for the names and phone numbers of their close contacts, as well as their extended contacts, because we do need to reach out to them as well. We have had some individuals say, again, this covers the entire spectrum. So an individual might say, I live alone, I don't currently work, I haven't left my house. So that would be that would be virtually no contact tracing. We have other individuals who say, well, I went to a bar, I went to a party, I went to a large party, I went to a concert, I went to, I traveled. So as you can see, those numbers can get very big very quickly. Next slide, please. So it's important here, before we do a little further deeper dive into the tracing, is what are define some words that I'm sure you've been hearing on the news constantly. So when we talk about isolating someone, that individual is already ill. They've already tested positive. And we want them to be isolated from the rest of the community, both their internal community and the broad community, so that they do not spread the disease. When we talk about quarantine is a preventive measure. So for individuals, whether you're isolated or quarantined, you are restricted to your home, you're not allowed to go out, you are really to stay by yourself. The difference for public health and for the community is that, again, the individual who is isolated is ill. The individual who is quarantined, we believe might have been exposed and is at risk of becoming ill. So we want to prevent that. So quarantining is a preventive measure. Next slide, please. So another very important topic throughout this whole time has been testing. And I'm sure you've heard a lot about it as well. So to kind of take a step back to go where we started, and then we'll move forward. The state and ODH has issued many guidance documents around those at most where priority should be given for testing. Again, as you probably heard, initially there was a very, very limited supply of not only the tests, but the reagents, as well as the actual labs that could run those tests. Here in the state, originally it was the Ohio Department of Health was one of the, if not the only lab that could run the tests. As the pandemic progressed, the healthcare systems here in our area stepped up. They massively increased their capacity to test. We were also then able to get the necessary supplies. So from about March to May, the priorities are listed on the screen right now. And the individuals who were tested were prioritized for testing were symptomatic individuals who were hospitalized, or those really on the front lines, healthcare workers in hospital settings. We also had priority 2, which was congregate living situations, first responders, those with underlying conditions. So again, those guidelines were in place, or were put into place based on capacity to test and supplies. Next slide, please. We will speak about how those tests have since expanded, but I think it's important to note, if you haven't gotten tested yet, if you have, you've obviously experienced this firsthand, but tests are conducted via what we call the nasopharyngeal route, which does go through your nasal cavity, kind of to the back of that area to obtain viral material, to obtain cells. There's another type of test that just swabs the anterior nares. If you've heard about some of these self-administered tests, that is what that is. There is some debate as to which is the more efficacious test, which produces the better results. But in general, this NP or nasopharyngeal is the test that is being recommended. It only has to go in through one nares, one nostril. It doesn't have to go into both, but it does, again, it is uncomfortable to say the least. Next slide, please. So I think it's also just quite important to note that the picture you just saw of the nasopharyngeal test is actually looking for the presence of the virus, and it detects it through genetic testing. That means that your body has produced the antigen. It's showing us the antigen. It is not showing us whether you've already been exposed and your body has produced the antibody. So that test is actually what it is called an antibody test, and it's a blood test. So it is not the nasal swab. You actually need to have a vial of blood collected, which is then run to detect the presence of antibodies to see if you have previously been exposed. Now, what that doesn't tell us is when you were exposed, and the science is just still quite unknown, quite fuzzy as to whether does this protect you? Is it lifelong immunity? How long does the immunity last? That's just what we don't know. So it's also important to note that since May, we do have an average number of tests that have been conducted through our local hospital system, and that's ranged anywhere from over 10,000 to over 15,000 tests per week. And what we know as well is that the positivity rate from those tests is at 3.7%. Next slide, please. So kind of now wrapping up this testing conversation, a few weeks ago on June 11th, ODH reissued guidelines around testing priorities. And it is now, they're up to 5 priorities. And it does say that anyone who would like to be tested is eligible to be tested. The first and second priorities are really continue to be around those who are ill, those who are hospitalized, healthcare workers, individuals in congregate settings. But you now do not need to be symptomatic to be eligible to be tested. Next slide. So it is though important to note, despite this expanded testing, expanded testing priorities, it's still important to note that if you present to a hospital for testing, you do need a doctor's order. It's just not a, if you will, walk up. So you do need to go through a health screening, and you do need a healthcare provider's orders. We also know, like Director mentioned, that the federally qualified health center community here in the city are also offering tests. And those do require a virtual visit or a type of screening. No doubt you've heard about the drugstores that are offering tests. Each one has a somewhat slightly different process, but in general, you can go onto their website. There's a portal, you fill out a questionnaire, you're told when to report. Those are largely drive up, and they can be self-administered tests. There's also a lot of testing that we know are happening in the community. And then lastly, the state is doing what they're calling pop-up tests. Those appear to be happening in areas where they're seeing an uptick in cases. Most recent, I think it was last week, and the closest to our area was in Elyria. So I believe the next slide will transition us back to the director. I'm happy to take questions at the end. Thank you.
All right, thank you so much, Commissioner. All right, so the next portion is around demographics. And again, if you, as I mentioned earlier, we had a very busy weekend. So these numbers are as recent as Friday, June 26th, when we had 2,117 confirmed cases and 74 confirmed deaths. So our first slide here on the demographics is around age groups. So we are seeing a large uptick in cases in the 20 to 40 age group. But as you can see from this slide, while it's still a lot, 109, we do have some very, very young people. We've had a number of infants under the age of 1, but these often then we work very closely with the families to try to, again, mitigate the amount of spread from those positive children. We also put these across the board. The 60 to and higher age group are the ones where we watch very closely and work very closely with them, just because of the risk in those age groups. But as you can see, we have across the board, I believe our oldest case is 103 years old. All of our confirmed cases by race and ethnicity. So disproportionately, as we know, we've seen and heard and talked so much about the non-Hispanic Black. We have 63.7% of our cases. Non-Hispanic White is 16.9%. Hispanic Latino is 5.8%, or 122 cases. We have 26 or 1.2% that are Asian. And we have a combined 12.4%, which are either other or unknown. Racial and ethnic minority populations have a disproportionate burden of underlying comorbidities, including diabetes, cardiovascular disease, asthma, HIV, and other chronic diseases, therefore more susceptible to COVID-19. Racial and ethnic minorities in urban settings tend to live in more crowded conditions by neighborhood and household, and are more likely to be employed in public-facing service fields. As we all know, distancing is a privilege, as is isolating at home, working remotely with digital access, and access to services like grocery delivery. Also illuminated are the health inequities and disparities due to health insurance access, poor quality of care, initial inequitable access to COVID testing, and virtual healthcare access, food and housing insecurity, and workplace-related exposure. Collectively, we must address this and close these gaps of inequity. As we look at the next slide, this is, we collect and really look at this data very intently. This is the date of onset. It's critical to us to understand the epi curve and the progression of illness over time. And it also helps us to understand perhaps what happened during this period of time, perhaps what was going on in the community, or is this when retail opened, or when bars and restaurants opened, or maybe events were happening in the community. The x-axis, or that along the bottom, represents the Center for Disease Control and Prevention, the CDC. They call them the MMWR, Morbidity and Mortality Weekly Reports. And this is just the week of the year. So as we see, sort of week 6 starts with the week of February 6th, or February 8th, I'm sorry, of 2020. So we're starting to see much higher numbers starting in late May, early June. I also included this slide as we look at hospitalizations. We've had 465 individuals who have been hospitalized due to COVID-19. This is interesting along age groups, and the one I just wanted to draw your attention to, which appear to have the biggest swings in hospitalizations. So going from sort of not the lowest necessarily, but very low to very high, is that amongst the age group of 50 to 59. And that spike happened around the week of May 10 to May 16. This slide, the entirety of this slide represents March 23 to June 26. Tragically, we've lost 74 people to COVID-19 in our confirmed deaths. As we see from this slide, the 70% of our deaths occurred in people over the age of 70. Often we are talking to family of the decedents if they died at home. Often they have actually died either at a long-term care facility or at a hospital. And one of the things we're looking at is how long each of these individuals were hospitalized before they died. The race and ethnicity of our deaths. So 55.4% or 41 of them were non-Hispanic Black. 19 or 25.7 were non-Hispanic White. 3 were Hispanic or Latino. 3 were other, and 8 are unknown. I just wanted to share that these have been very, very emotional. This entire experience has been very emotional, but each of these deaths are very, very emotional to us. And we do light a candle every time we report our deaths, which are investigated by the state. But we've worked very closely with a lot of long-term care facilities and hospice. Hospice has been another big partner in this work. It's just, it's very, very startling, and why we take this so seriously. I wanted to also mention that if you look at the death or the dashboard, it will include the number of 75. We have one what we call probable death. Probable is actually a CDC defined term, and this is an individual who has been a close contact of a confirmed case and somebody who experienced symptoms but was not tested. So the 75th case, or the additional death that's reported on our dashboard, is a probable case. The medical examiner is doing some post-mortem testing. So we are trying to see really and truly if they may have died of other causes, but also had symptoms. So there's an algorithm for which post-mortem testing is taking place. So that is happening in our hospitals and in our long-term care facilities as testing materials have increased. So we're really trying to analyze that as well. But again, all of this information is on our dashboard. So I wanted to turn this over to Chief Walker-Miner, as she can talk a bit about some of our outreach and intervention. The more we learn, the more we can target outreach and interventions. We have all of our materials translated into multiple languages. We're working very closely with so many agencies, including Global Cleveland, to reach international and refugee persons. And our Office of Minority Health has been very busy reaching out to faith-based community and a number of other communities within Cleveland. And Chief is going to talk about a really cool project that we're working on. So, Natoya?
Sure. So just a couple of things that you all, I'm sure you have heard about. About 6 weeks ago, we worked with, through the mayor's office, worked with Director Cox and Chief Martin Thompson to identify recreation staff that were considered non-essential. We identified 180 recreation staff considered non-essential. We brought them in, we trained them on the basics of outreach for COVID-19. City staff conducted the training. It was a series of city staff across multiple departments, and we brought them in to share with them about COVID-19, to share with them about best strategies for conducting outreach work. We walked through some of the social distancing and safe measures in terms of the face coverings that they would have. And what we did was work very closely with Print Shop to print up cards, if you will, door hanger cards to educate and inform the community. We wanted to educate and inform this entire community, and the 180 recreation staff walked this entire city, every single ward. It took them 5.5 weeks to complete the city, and that wrapped up last Friday. So they did that. Mary McNamara, Director of Aging, as Meryl, Director of Health, just reported, worked very closely with us. She and her team pushed information through all of our senior centers, our senior buildings to push that out. In addition, on a weekly basis, Director Gordon, Commissioner Sosiak, and I met with Chief Executive Jeffrey Patterson on a weekly basis so that we could also touch the CMHA families. A few weeks ago, in partnership with University Hospitals, we were able to secure 10,000 face coverings. The reason why we needed to do that is because that is probably the #1 item that people indicated that they could not find. So UH donated 10,000 face coverings for 3 communities, Buckeye, Glenville, and Meryl, what's the third one? I can't remember. Buckeye, Glenville.
Huff.
Thank you, Huff. Thank you. That same week, we worked with an organization called Until We Do It. Until We Do It is a nonprofit that's based in LA that's dedicated to ensuring that face coverings reach vulnerable populations. So working with that entity, and I engaged Francis Mills, who is the project director for the Office of Minority Health, to work closely with me on that. We were able to secure 36,000 face coverings for vulnerable communities in the city of Cleveland. Francis Mills is working very closely, and she's identified a number of nonprofits that we are working with and really pushing out those face coverings to make sure that Clevelanders receive the face coverings. So, and that is across the board. So those 36,000 are across the board. We designated a couple thousand for the rec centers. We also designated a couple thousand for aging, and the balance of those is being pushed out through our nonprofit partners in the city of Cleveland. So those collectively represent the outreach strategies that we have been pushing out in order to make sure that our community is educated and informed. Lastly, the Office of Minority Health is in the process of having signage for buses that will be out there very soon, just again to reiterate the critical importance of the face coverings and washing of the hands. Those seem very basic. Those are the things that we all learned by whomever raised us, but those are very necessary steps. As has already been said, too frequently, what we're seeing is people aren't wearing the face coverings, especially young people, and or are wearing them either below the nose, which is not good because that's the way that it's transmitted, that we learned and heard here today, and or having them hanging just almost as a necklace on their neck. We need to reinforce in our communities the critical importance of these face coverings. And we emphasize the face coverings more so than the gloves, although initially all of us went out and purchased gloves because the gloves can transmit, because the gloves act almost like our hands. If we have the gloves on and we bring it to our nose or face, we still could become infected by the virus. So it's better just to not wear the gloves and just frequently wash our hands. But it's absolutely necessary at this time for everyone to wear the face covering. So one of the things that we'll ask you to do as you continue to push things out to your communities is please reinforce that message. We need that message reinforced, especially to our young people. People like me that have 18-year-old, it's very difficult to get him to do that. But we have to push that because as Meryl has indicated, the numbers of young people that are becoming infected are going up, and it's because they are beginning to socialize that much more. Thank you.
Thank you, Chief. I have just a couple of quick more things just to share. I really want to thank so much the residents of the city of Cleveland who have cooperated with us when we've called to do this contact tracing. As Commissioner Sosiak shared how critical it is. So we would really ask that you help us in encouraging constituents to be responsive to the health department when we call. It is so incredibly necessary. The other is that some families may have, over the last 4 months or so, perhaps not taken their children in for wellness visits and may have fallen behind in childhood immunizations. This is really so critical for them. So please, please, please make sure to add this message as we continue to encourage families to do so. The Cleveland Department of Public Health health centers are reopening to 5 days a week, and we are providing immunizations there and encourage families to bring their children so that they can get caught up on all of their immunizations. Want to put a plug in early that influenza vaccinations are so necessary. While it is not yet ready for this fall, it is a critical prevention tool, and we encourage everyone to get vaccinated. As soon as there is a vaccination for COVID-19, we will be on the front lines promoting that and also providing that. Obviously, we are just as anxious as everyone else for that to get developed, and are really encouraged by by how many people around this world are working on that and trying to develop that. I may have said it before, but it bears saying again, we are so fortunate to have so many volunteers who've helped our department. Volunteers from Case Western Reserve, from John Carroll, from Cleveland State, and others. There are many students, medical school students, public health students who have been working with us and just come in on the weekends, throughout the week, and have been tremendous. The health department staff have really, again, stepped up and been an enormous effort for this work. It has been huge. So I really want to thank them as well. I want to just say a little shout out, say hello to my mom and brother who are watching today. But I will leave us all here with the prevention message. Please stay home unless it's absolutely necessary to leave, especially if you are sick. Don't confuse seasonal allergies or maybe a slight cough. These can add up very, very quickly and can instead be symptoms of COVID. Wash your hands with soap and water frequently and avoid touching your face with unclean hands. As Chief Walker Minor said about masks, they are not necklaces, they are not headbands. They need to be covering both the nose and the mouth, and they need to be worn when you are around others. sanitize and clean frequently touched surfaces, or use a barrier, maybe a paper towel, to touch a frequently touched surface so that there isn't the transmission of the virus to your hands. And we're also trying to use the word physically distance from others by at least 6 feet. We're trying not to use the word socially distance, although that term is now so frequently used, because we recognize the profound mental and emotional impact of COVID-19 on everyone, whether you've had it, whether you know somebody who's had it, whether you've lost somebody to it, or whether, well, everything has been impacted. Our world has been turned upside down. So it really has hit people on so many different levels. We need to be together. We need to get through this together. And we need to look out for one another. So that is the end of our presentation. And Councilman, I will stop sharing my screen and turn it back over to you.
All right, thank you so much. Once again, everybody, if you have a question, please raise your hand. I know that after I have a couple of questions, I have so far, I have my colleague Carrie McCormick, Joe Jones, and Matt Zone, who have asked to make comments so far. Please put your raised hand function in if you have a question, and we'll go from there. Just a couple of things, Director, before I move to my colleagues. State orders, who trumps who? How does this work, and how are the orders? Does the city have to follow all of the orders of the governor? So the governor puts out social distancing or physical distancing measures on how you can open pools or how bars can operate. Does the city have to adhere by all of the rules that the governor puts out? Who has jurisdiction?
Sure, Mr. Chairman. So the state puts these orders out. We can make them more stringent. We cannot make them more lax. Okay.
So you can't make them stringent or lax. You basically have to abide by what they put out, right?
Yes, Mr. Chairman. Yes.
So the reason I asked that question is because when we close our pools and we close our basketball courts, and I don't think the public really they may not understand that a lot of it is because we could not, as when we canceled the Feast of the Assumption, that we could not adhere to in any way fashionable, in any way possible, the governor's guidelines. We just couldn't accommodate that. Could you share how that works and how that operates?
Well, Mr. Chairman, follows any other order that would come from the governor, from the state, or any health department director does have an enormous amount, sort of an overwhelming enormous amount of authority to declare public health nuisances, to issue the orders that previous director Amy Acton issued. So the state was required to follow those orders. Again, we could make them more stringent. If we were to break them, it would have, I believe that there's a whole process that we could have gone through to do so. But all of the communities had to follow what were issued orders by the governor and the state health director.
Okay, great. And Director, can you kind of give us the process of, I know you went through a very extensive, thorough presentation, but there's a lot of concern, and let's just be honest, that the African-American community and Hispanic community nationwide, as well as locally, are being disproportionately impacted by COVID-19. Can you tell us what your strategy is that you're deploying? And I will encourage some of my colleagues to ask and probe a little further, if I could, because I know that a lot of leaders in the African-American as well as the Hispanic community has really called and said, what is the city's strategy to deal with this disproportionate impact?
So, Mr. Chairman, our outreach effort has been to work with every community organization and every organization out in the community. As I mentioned, we have people across our health department who are working within the community and with agencies that we either contract with or we partner with. We have been very fortunate to have a very robust Health and Human Service leadership at Cuyahoga County, and we're working with them and all of those agencies and all of the organizations that fall under that work to do outreach, to reach communities where they're at. We've been working very closely with the FQHCs who are now standing up testing. We've also been very fortunate to have some very dedicated testers at Cuyahoga County Board of Health and Metro Health who've done a lot of testing. Now that testing is more and more available in the community, in congregate settings. We've given a lot of information to city council members to promote in their newsletters and in their communities as well. As Natoya mentioned, there is a lot of, we've done door to door. Initially, the mayor's initiative included knocking on doors, but we have not just settled on what we're putting out in social media, but every single door got a set of information, a door hanger. So that information has been going out as we see communities where their numbers are increasing. We've done specific intervention around distribution of masks and face coverings so we can give individuals not only more information on COVID-19, but also ways that they can prevent the spread, either protecting themselves or protecting others from them. Some food and basic needs have become, as I mentioned earlier, a very critical need in the communities. So we've been working very closely with the food bank and with others around how, again, to make sure people get what they need, but along with that, they get additional information about COVID-19 prevention. We can always do more, and whoever and however we can work in addition to, with the community, we're happy to do so. I guess I'll say just one last thing, but it's repetitive what we presented in the earlier. Our Office of Minority Health has been working with the faith-based community very closely and have been providing them a lot of resources and information that can be passed on as well. We make sure that everything we have is translated into any language that our constituency needs. Almost everything on our website is translated into at least 9. I think we might be even up to 13 languages at this point. So all that information is available.
All right, and Director, let me push a little bit further on that one and just make sure that I understand the process. So I'll just repeat it. So I go in to get a test at one of these hospitals or an FQHC or whatever else like that. Are they responsible, or under CDC guidelines, if I'm understanding from talking with you and others, that there is no mandate from the CDC that they ask specifically or that they try to capture that data of if somebody is Black, Hispanic, whatever ethnicity or race that they may be, that is self-reported. And hospitals, even though they've been trying to do it, it is still self-reported. That's the reason, if I'm understanding, why we had that 25 day, 25% of the people that we didn't have the data for background on race or ethnicity. So can you just, I'm trying to get people to understand that process and why contact tracing is so important. And we're basically coming in on the back end, not the front end.
Certainly. Thank you, Mr. Chairman. So correct, that is not a requirement. It's not a federal requirement to provide that information. We actually, just so that members of council know, when we received the original, I can't remember what, we called people back to ask them specifically if they would provide race and ethnicity data so that we could start to increase the amount that we had, because it is not always provided. Often it's not provided by the testing facility. So if you go to a drugstore, they may not collect that information at all. So there's a lot of blanks in that. So yes, the contact tracers do make a special effort to inquire so that we can have more complete data for the community.
All right, because in looking at the data that you shared and that we talked about yesterday, there's a lot of, especially around ethnicity, that there's a lot of missing data, or people have not reported what ethnicity they are. So I just, just want my colleagues to understand that, and they probably have further questions. One last question, and then I'll pivot to my colleague, Councilman Kerry McCormick, and then Councilman Joe Jones has the floor after that. The other question I have is spikes. Were there any spikes that we noticed after civil unrest that took place after the protest downtown, or what venues have we seen we're the host, or I'm not sure if I'm saying the right term, but what venues have we seen where people have run into the biggest spikes? Because it seems like we're seeing spikes, not just locally, but around the state as well as around the country. And where are those spikes taking place? Because I know we're slowly but surely turning back on the faucet, but where are you seeing those cases originate from?
Sure. So, Mr. Chairman, that's when I was talking a little bit about the date of onset, the graph that showed kind of when we start to identify what might have happened around certain times where there are spikes or increases in the number of individuals who might have reported that their date of illness onset was. The spikes start to happen, again, it's June, I believe June 3rd, June 4th is when we start to see that. That's a few days after the curfew was lifted downtown, or the daytime curfew was lifted downtown. We do ask each individual in the contact tracing if they did attend a mass event, a rally of some sort, and trying to get as much information so we can see whether there is some affiliation with one of those days or an event that occurred throughout that weekend. We don't get many of those responses. What we're starting to see right now, which is a more concerning trend, is how many people have indicated that they have traveled, perhaps traveled to a beach, eaten out. A lot of nightclubs have reopened, and so people tend to relax the wearing of face coverings or how close they're getting to others. So those are some of the things that we are starting to see, and why we're seeing more in the younger, trending younger in our case count.
Okay. All right. I'll save anything I have for closing remarks, but I'm going to pivot now to my colleague, Kerry McCormick, and I'm going to ask if we could, if Councilman Zone could be moved up, because he has to go to a BOZA hearing. So what I'll do is I'll have Kerry McCormick, and then if I could, I'll work. If I just sent Councilman Jones a message, if he could send me a message right back, because I just want to make sure we manage this if we could. Councilman McCormick.
Thank you, Mr. Chairman, and I'll be brief. And to the director and her entire extended team, thank you for the work that you're doing on behalf of the citizens of Cleveland. I just one question for you, and that's related to contact tracing. And I wonder if you can speak to if you feel we are in a good position, not for today, but in the next 6 to 12 months for our team, for capacity reasons, for contact tracing, or if this is something that you feel will need to be expanded, whether internally at City Hall or externally. So could you just speak to our planning to be ready and equipped for contact tracing for the next year or so?
Thank you, Mr. Chairman. So what we have been really balancing is that so many of the internal CDPH staff have taken on some of this work. And so as they have had to go back to their primary responsibilities, we have been doing this constant balance of how we need to bring additional contact tracers in. The state has been funding local health departments to do this work. Chief Walker Minor and Commissioner Sosiak and I have been working hard on getting the contract together to be able to make sure that we're able to bring on contracted contact tracers. Gets me almost every time. And that will cover us for this sort of period of time. That the state is also trying to determine is how far into the future we need to make sure that we have enough individuals to conduct this work. It's sometimes unpredictable of how many we need on a shift because as Commissioner Sosiak said, some people, it's a pretty simple 15 to 30 minute interview. And for some, it's an entire day because of where they've been and what they've done. So as we keep up with these cases each and every day, we are not behind. We are keeping up with them every single day, which we are very proud to report. But as such, we are trying to ensure that we have the appropriate amount of individuals. And thankfully that funding is coming forward. Contact tracing is not the entirety of the work. So, but it arguably can be some of the most time consuming. So yes, we are looking at this until most likely December of next year, but at least getting us through June of 2021, which is where these grant periods for the most part are till.
Thank you, Ms. Chair, to the director. I'm happy to hear that we're thinking out, a year and a half even on making sure that we've got that structure in place. Thank you, Mr. Chair. I'll yield to Councilman Zone.
Thank you so much, Councilman McCormick. I have Councilman Zone and then Councilman Joe Jones. Thank you, Councilman Jones, for yielding your time.
Thank you, Mr. Chairman. Thank you to my colleagues, McCormick and Joe Jones. I need to jump back in the BZA hearing. Just a comment and then a couple quick questions. First of all, Director and your team, the contract tracing is working well. Unfortunately, I know 2 of the 75 victims. As you know, the first religious, Father Monzi, our parish priest at Our Lady of Mount Carmel, passed away. But I have to say, your contract tracers were amazing. All of the nuns and non-religious who worked at the church and the school and the follow-up, they were kind, they were caring, they were compassionate. And it was reassuring to know that your department's leading with compassion, but the due diligence and following up was very thorough. And I just wanted you to know that from just a personal experience. A couple questions through the chair to the director. You talked about sharing of the data with the state. And I know the data you showed us was from last Friday. I would assume we're sharing that on a daily basis. So can you talk a little bit about the chain? How does it, we look at on the national news and we see these national or international numbers. Talk about how does that data go from the city to the state to the CDC can you speak a little bit about that, please?
Sure. Actually, I'll through the Ohio Disease Registry System, the Commissioner Sosiak mentioned. Commissioner, you want to take this one? That all it's all interconnected. So I'll let her respond to that.
Sure, Director, thank you. Through the chair to the councilman. So all of our data, so the Ohio Department of Health can see all of our local data through ODRS, the Ohio Disease Reporting System. And so they are able to do that pull and those extractions directly. What we have to share with them on a weekly basis is actually a report of our outbreaks. So every outbreak that we're investigating in the city, we have to manually key it in every week.
And can you?
I'm sorry, pardon me, through the chair to the councilman, then it's ODH that really does that communication then to the CDC or beyond.
And through the chair to either the director or the commissioner, I think I heard Director Gordon saying an outbreak would be considered if 2 or more individuals in the same working conditions or close proximity was infected. Is that how? So when we get these questions, that's how we communicate it back, right?
Through the chair to the councilman, yes. So it's 2 or more people. Now, I think it's important to note that that's not a house. So there's, you know, multiple relatives living in the same household, multiple generations, and we have had, sadly, we have had those situations. We don't open an outbreak for that in that setting. But if it's more congregate living, long-term care facilities, some of the clubs or other where you're not related, those do get opened as outbreaks.
Okay. Through the chair to the director, I've received an inquiry last week at my office. Individual wants to travel out of state. They've been told that they can't enter this state. They were going to go to Maine unless they had a negative COVID test within a 72-hour window. So they're asking me for assistance on, one, getting the test, and I told them I refer them to their primary care physician. But could you talk to could you?
Thank you.
I wasn't going to send them to you, Director.
Thank you. I was going to say, you're going to send them to the health department, everybody else does, but yes, thank you.
No, absolutely. They shouldn't overwhelm. You're overwhelmed enough. Talk a little bit about traveling from out of state. Could you speak a little bit to that and concerns that may be associated with that, which aren't obvious?
Sure, Mr. Chairman, you know, it's on top of everything else. We also try to keep up with what are the most current orders nationally and internationally, and then also here in the state. I think that in the next period of time, as these numbers have just increased so significantly in some of the southern states, I'm sure you've all heard or seen or read, there may be conditions by which if you do travel outside of the state or come back into the state, you might need to quarantine or perhaps a confirmatory test, although confirmatory tests are the lowest on the priority because they really want to make sure that people who are symptomatic get tested first or are in the more kind of critical conditions. But that is, we're hearing more and more of that. As you know, during the shutdown, you couldn't travel across state lines without quarantining when you come back. So I don't know what's on the horizon for that. You know, we are hearing more, you know, the EU isn't, I believe at this point, considering not letting US residents travel there until our case counts and our rates start to come down. So I think right now the best thing to do is, and we encourage anybody traveling to look at the CDC website. They have a pretty robust and thorough travel section there of what to do and what are the precautions being required of individuals traveling out of state and out of the country. And just encourage people to look at that to know what is the most up-to-date regulation. Now, to get a confirmatory test, again, you can, there are these drugstores, there are a lot of places that are, you have to go through a screening of some sort. So I haven't looked at one of the most recent screening questionnaires to know whether or not travel is on there, but I'm assuming that that will probably be one of those that then allow you to get a test.
Unmute yourself, Councilman.
I'm sorry, Director. Chairman, thank you. The chair to the director, summer outdoor gatherings that, and you even heard our chairman said, you know, one of the largest multi-day gathering in our city, they've gone ahead and canceled it. But what about summer gatherings in the month of August? What could you shed? I know it's all predicated upon the numbers and the rate flattening and going in the other direction. Is there, what do you foresee on the horizon for the month of August in our city for individuals who want to gather in public spaces, outdoor public spaces?
So it's a pretty broad question. Gathering, meaning like having an event?
Yeah, like if there was to be an event in one of our parks or, you know, I've received several inquiries about would the city allow us to have a gathering at a park? I do park programming every year through Land Studio. We do organized programmatic events in parks all throughout Ward 15. We've suspended that because of this. I'm not referring specifically to that, but something similar like that.
So, Mr. Chairman, to the councilman, I'm not sure I can give you a definitive answer to that. What I will say is that health and safety will be the determining factor of whether or not permits will be issued to have events in the city of Cleveland.
Fair enough. Last question. Could you speak with a little bit about, is your department the one who's establishing the protocols for our safety forces and our other employees who interact with the public on a daily basis and they're considered essential employees? Who's developing that? Are we allowing that to be developed by their own respective divisions for our workforce?
So, Mr. Chairman, I would sort of defer to public safety for that, but we talk to them almost every day. They also have a medical unit and a medical director, and I believe two. So they are intimately involved in the protocols for the public safety personnel. Very early on and throughout, we were working with most of the city departments around safety protocols in terms of people in the same vehicle, mask wearing. We provided a lot of that initially as well so that they could be safe until we were able to procure and actually get supplies into the city. As you know, there was a huge shortage early on. But certainly we provide guidance, but through public safety, they have personnel who advises them as well. And they're, you know, this is the time we've all been reaching out to all of our trade associations and our peers and looking at best practices. So I know that they have been working with the State Department of Public Safety and other departments across this country about best practices and protocols.
Thank you, Director. Thank you, Mr. Chairman.
Thank you, Councilman Zone. I see Chief Walker had her hand up. Does she have a point before I go to Councilman Joe Jones?
That was a while back.
All right.
So I'm good.
All right. So next up, I have Councilman Joe Jones, followed by Councilman Bashir Jones. Councilman Joe Jones, you have the floor.
Thank you, Mr. Chairman. I have a point of information. The first point of information is, are we going to have any house cleaning work after this session, or is this session just strictly on the coronavirus issue?
This is on coronavirus. However, after we end on coronavirus, if you have a point of interest, since we don't meet on a regular basis, I will allow you the privilege of addressing if you have an issue with that.
I do, Mr. Chairman.
Right.
So
Therefore, at the end for that part, but if you have
yes,
COVID-19, we'll deal with that. And then at the end, if you have a miscellaneous a point of order, then we'll work with that at the end, okay?
thank you, Mr. Chairman, for allowing for the be house cleaning work at your committee assignments. The first question I have, first I want to thank the director for doing such an outstanding job as it relates to being able to field the issues. And it sounded like I was hearing the director saying that they're actually doing the tracing, the tracing right now for the COVID virus cases in the city of Cleveland. I don't know if I heard that correctly, Mr. Chairman, to director, but if that's the case, how many people do you have on staff that's helping you?
Mr. Chairman, to the councilman, we have used over 54 of our own CDPH staff. We have in the neighborhood of 20 volunteers who've been coming in, and we are in the process of contracting through, I believe, an additional 10 to 13 contact tracers through the state's funding process. They don't all work all day, every day, so we've been able to spread them out throughout the week and the weekends, as we are a 7-day-a-week operation.
Director, if I could everybody put themselves on mute? There's a ticking noise somewhere, and we don't know where it's coming from. So could everybody put theirs on mute while they have that? Thank you. Go ahead, Director. Proceed.
Yeah, that was did you hear my response?
Yeah.
Okay.
Yeah. So, Mr. Chairman, to the director, looking at like the state of New York and other states that have thankful to our governor for quickly shutting down our state faster than anyone else. When this was a major issue back in the very beginning of March, I started sounding the sound off to my colleagues about the significance and the importance of communicating to our constituency base what this particular issue is and what its potential impact would mean. And so it was really good to see that, the grown-ups stood up with the state of Ohio, but not so much on the federal level. And so given the fact that we're missing an action on the federal level, how much funding will it take, given the fact that it almost seems, to me as an elected official looking at this issue, this nightmare that's happening in our country. Our country has become one of the biggest spreading systems across the entire globe. And so how will, if we continue to see the spikes that we have in the southern states, how do we deal with that here in the city as relates to, say, for an example, Florida? Do we have people at the airport taking people's temperatures when they get off? I mean, how extensive is our department working in those areas in that way? Do we work out at the airport, Mr. Chairman, to the director, screening people?
So, Mr. Chairman, to the councilman, we would have to check with the airport director, Director Kennedy, of what all the protocols are out there. As you know, for the last number of months, there were, I think that the number of flights and number of traveling passengers dropped, precipitously, at least by 90-some%. So there really weren't people traveling. Now that has been on the increase, there's each individual airline, the TSA, the airport, the FAA, all of those regulations are coming down. And I know that they've been on top of all of this since day one as well, since so many changes happened there. And since as Commissioner Sosiak mentioned earlier, the initial cases were individuals who traveled. So they were some of the first ones in on all of this work. But we would have to check with Director Kennedy on exactly what is happening at the airport in terms of tracking and temperature testing, et cetera.
Because I think that, Mr. Chairman, to the director, that would be like one of your major ports of entry is our airport. And I know that when I come downtown, you guys are, the mayor has done a great job with making sure that there's testing coming in that door. So you guys have your, heat sensors, and you're checking us for our temperature and stuff like that. I thought that was wonderful. And it would be good to see that at the airport. Can we find out if that's happening at the airport, Mr. Chairman, to the director?
I sure will.
And Mr. Chairman, to the director, with the increases and the spikes in other states, are we sending out any warnings to the Cleveland area residents to say, hey, do we have the ability capacity to say that, flights coming in from Florida, or is that all state level government that can say, hey, we're quarantining from a certain state that's sending people to our city? How does that work, and is that being handled?
Sure, Mr. Chairman, to the councilman, that's a federal and state level policy decision that would need to be made. And also, individuals who would be landing here may not be just Cleveland residents. They might be residents of other states or other communities around here. So an individual community making a determination of allowing somebody as well, and which could make it even more of a concern if sick individuals are getting back on an airplane.
Well, Mr. Chairman, I'm kind of concerned about, and I guess I can ask you this question. What is your outlook right now for the Cleveland area? What's happening around our region and our state as relates to this virus as it begins to progress forward into the fall?
Well, Mr. Chairman, to the council, we're watching this every single day, and we are learning from the individuals that we interview where they've been and what kind of situation occurred by which they may have either been infected or infected others. Our concern, as we indicated, and why we continue to provide that prevention message is stay home unless it's absolutely necessary for you to go out. As people are continuing to go out and go to events, to bars, to restaurants, to nightclubs, and we're starting to see those cases go up, that is a grave concern. That it's trending younger for individuals who may not find value or want to wear a mask over their nose and mouth, to stay within or outside of the 6 feet away from others. These kinds of messages continue to be said over and over and over again, to be able to bring these numbers down. This virus is not behaving like influenza, where it essentially almost goes away during the warmer months. I mean, it's certainly not happening in the southern states where it's much warmer than it is here. So this virus is thriving in human hosts, and it needs another human host to continue to thrive. So the more we can stop it from going from person to person is the only way we're going to be able to control this. But we saw numbers go down. We saw that flattening of the curve. We were very optimistic, but the state and the country, the economy, there are a lot of pressures to reopen. And so we still just encourage you, if you're going to go and do anything, to be safe, to be very diligent about making sure that you are protecting yourself and you're protecting everyone else, and everyone else is protecting themselves from you.
And Mr. Chairman, ideally, and I know that sometimes we don't have an ideal situation. We know we like to have to deal with certain issues, but sometimes we just don't have, or we don't have the resources. But ideally, to get your hands around it somewhat, what would that take, or what would that look like to really put together? And I've heard about these tracking programs, and how efficient and effective that they would be. And then I've talked to different people because of the slow response of the federal government and the failure of the federal government to respond and act quickly to assist and help with states and local governments. Some of these people believe that we're just inevitable. We're just, because they dropped the ball and they're continuing to drop the ball so bad from the federal level, from this president, that they think that we're going to be totally consumed by this virus as a nation, because we just don't have nothing in place as relates to systems that are really taking care of the business of protecting Americans' health. So that's one view of it. The other view is ideally what tools or resources you would need to have to efficiently protect the citizens of the city of Cleveland. If you had to put a number on it, what would that potentially be? And how would that look to have a system that really fundamentally works, where you're not so taxed as a department to deal with this issue?
Director.
So, Mr. Chairman, I'm not sure I could put a number on it, but I think that what it takes is all of us. We aren't focused on what is working against us. What we're focused on is providing the kind of prevention messaging out there, giving people information that they need, trying to be the trusted source of information and prevention messaging and anything else we can provide to the community. That's why we put all this information out on our website, why we did a door-to-door outreach strategy, why we are working with communities to provide masks and anything else we can provide. Health departments across this country are doing what we do all day, every day anyways. It is one of our jobs. That's why I put the 10 essential public health services up there. This is the work we do. In COVID, it's just on steroids. It's just so much, but this is the kind of work we do. We do contact tracing. We work on containing infection and communicable disease. But it's also about messaging. It's all about partnerships. And we ask you to help us with getting this information out as you see individuals, organizations, and businesses not complying. To encourage them to comply so that we are all working on this together.
And Mr. Chairman, the reason why I asked you to put a number on that was because it would give me a better idea. It's not, and I get what you're saying. You're not dealing with the federal level, but it's impossible to not deal with the federal level in your business, given the fact that they have all the money. And so now, for an example, so if you're okay with where you are, we need help in our neighborhood. We would like to see testing in our community. We know that the virus is spread. So how do we get testing, Mr. Chairman, to the director in the Lee Harbor Ward 1 area? Because I'd like to work with you to be able to do that. And then also secondary masks, we need face masks. So we had some kind of, we had Lee Road Baptist Church giving out face masks and stuff like that. What we're starting to see is that in some of the stores, they're selling the mask. They're telling the residents that if you don't have a mask on, we'll provide one for $1. So they're selling some masks at some stores. But at the end of the day, we need to try to figure out how we get more masks. How do we put something together? I don't know if that means bringing in some kind of celebrity, having some kind of event where that person can appeal to the young people and tell them the significance and importance of wearing the mask. Because like most Americans, as well as now the young people, we feel invincible. And so we're going out to the nightclubs and the restaurants and we're eating and we're not wearing the mask and we're not doing that. And we're getting all of these mixed messages on the federal level. Look at the president, he's not wearing a mask. The vice president is not wearing a mask. And then when you talk about this pandemic, it doesn't seem that on that level they're taking it serious. So our young people they are mirror reflection of what they're doing on that national level. And so we have to do a better job here. I don't know if that means showing the real impact with the media going into the hospitals, showing these people with the COVID virus, showing these images so that these young people can get it, hopefully get it in their minds to understand that this is a very serious situation, that they can be carriers, and that they can have negative impact on older adults or anyone else. And so I need your help, Mr. Chairman, to the director, to help me get that out to my people in my community, because I'm seeing a lot of our young people just absolutely, like you said, Director, early in your testimony, they're not wearing any masks. It makes no sense. And I have to go up and tell people, you know, I understand you feel invincible, but you need to stay away from me because I don't feel invincible. And so I need you to stay your distance over there, and then please don't speak unless you have a mask on. And so at the end of the day, I'm constantly having to educate people. And then when we look at our area in the 44128, it's my understanding, and Director, if you could help me out, what is our percentages in our area and the Ward 1 community? Because I've been asked this question by several people now.
Director?
So it's on the dashboard, Mr. Chairman, to the councilman, so which is located on our website. Look that up.
It's 44128 is my zip code.
Yep.
And 44122. 44122 and 44128.
Director, two things. Can you make sure that you work with Councilman, because I know you send out that link that everybody could look at regularly. And then also it sounds like he wants to talk with somebody on your team about how he can coordinate resources for his area. So can you assign somebody to reach out to Councilman Jones to make sure that you can kind of coordinate some of the strategies that he would like to do over in that area?
Yep, will do.
And the number that you have for 44128, did you give that to him so that we can?
Yes, I will give that to him, certainly. Yep.
All right, Councilman Jones.
What's that number?
So what we have here is that there is in 44128, there's between 130 and 189 cases.
Okay.
Now that's all 44128. That's not just Ward 1. And 44128.
44128. Yep. Yep.
What about 44122?
So 44122 just, well, what I have on our map is just the number of Clevelanders in 44122. As you know, there's just a sliver of individuals in Cleveland in 44122 because the rest of the zip code is suburban areas. So it's under the number under 13.
Okay.
I don't know how many streets represented in 44122, but they're under 13.
Okay. Thank you, Mr. Chairman, to the director.
Thank you, Councilman Jones. Next up, I have Councilman Bashir Jones. Then I have Councilman Kevin Conwell. And then I have Councilwoman Jasmine Santana. Once again, please raise your hand if you have a question.
Thank you so much, Chair. Thank you, Chair. Can you hear me okay?
Yes, sir.
Okay. A couple of things. What Councilman Joe Jones brought up, I thought was a very important point, and that is, I believe that our marketing, I believe that our marketing hasn't been what it needs to be, and even though when it comes to, and what it shows me is that diagram shows that between the ages of 20 and 29. So we know that between 20 and 29. They're not, with all due respect, they're not watching TV 20. They're not getting our newsletters, and they're not getting, they're not getting door hangers, right? So that age group is on social media. And what Councilman Jones brought up, I thought was exactly what I was on, is that we have to take this to the community in the sense of it has to be on the urban radio stations. Right, like the clear numbers that we are losing people. People are dying as a result of us not being safe. I would like to be a part of that, Chair. If that doesn't exist, I would like to help create it. And if it does exist, I like to be a part of it and enhance it, because you have to have the right voices speaking to the young people about what's going on. And even those who are not, are not listening, we have to connect with the right people, is what I'm saying. So, Chair to the Director, I guess I can ask the question, do you have a plan? Does the city have a plan to reach the urban market in a sense of urban radio stations, social media? What's the plan with that?
Sure, Mr. Chairman, to the councilman, I'll also turn it over to Chief Walker Minor, who's been very much involved with this work as well. But our health department does a tremendous amount on social media, Facebook, Twitter, and also, of course, on our website. But I know there's been some conversations with radio and some other ways that we're trying to be very creative to reach the community. Chief, do you want to add anything else?
Sure. I'll just add, thank you, Director. I know that we are working through our Office of Minority Health to get some messaging on the Burtonville Car radio station. I don't know the formal name of the radio station, but I do know that they have a radio station. As I indicated, through the buses, some advertisement through the buses. And the rec centers are set to open next week on July 6th. And we are working with Chief Martin Thompson, Director Cox, to get a schedule for our health mobile to go out and to do some messaging around that. If we have some of our nurses, and we have a few trained to do testing, then we can do that, but we're not, that needs to be shored up a bit. But certainly to go out into the community using our health mobile to educate and inform on all health information, but in particular, this one, since this is ravaging our community, to do that, Councilman.
Thank you, Chief. So there's really not a plan then to reach the urban area. And Chief, directed to the Chief, I would like to assist you with the marketing, because all of those things, they're going to reach very few people in that age bracket of between 20 and 29. And if it has been on social media, I haven't seen it. And as Councilman Jones said, it needs to be, it has to be more direct. Like, for example, I can remember that I wasn't taking it as seriously as some. I wasn't taking it as serious. But not until I had a uncle of mine who was in the ICU did it snapped me into reality. Mm-hmm. And so many people are just like that. Mm-hmm. Because we're living in it says that when America is sneezing, Black and brown people have pneumonia, right? So just trying to survive, and then going through what we're going through right now with George Floyd, and it's so many other things that just trying to survive is taking up our attention. So the message has to be more drastic. Like, people are dying. The message has to be drastic. And what I would like, if when people are in my neighborhood of Ward 7, if people are have contracted the COVID, I would like to know that. I would like to get that information, just like we get the information from the cops when they tell us, who's been shot and who's been killed and so forth and so on. I think that we should start getting an email that, hey, you have some people, you have some people in the in the Huff neighborhood who has contracted. I think that we should start getting daily updates about in what part of our community people have contracted it. Chair, is that something that we can do?
To the councilman, through the chair, our daily dashboard and I don't know if Meryl can pull it back up on her screen. Certainly it's an interactive, and so the numbers of cases you can see in the interactive by ward. It's not going to tell you the street. It will say, you know, whichever ward is impacted, the number of cases in the ward. That's strategic, because you have to remember that this is protected health information. So we have to be in compliance with HIPAA, the federal laws around health information and privacy. But we were able to, working with a phenomenal young man in public works, in public utilities, to create on our dashboard to demonstrate by ward and by demographics, so we can know where people are. What we don't want, and the reason why it's not as granular as to street, East 173rd, I'm sorry, not ward, but by zip code, is because we don't want anyone to convene on, you know, my address, 2222 Broad Street, trying to understand how I'm feeling and things like that, and get a story, or just wonder, and or which is probably worse, is to begin to stereotype and outcast people, which is one of the things that we have to be really careful of. That didn't come up in this conversation, but I'll just take the moment to say, you know, just really unfortunate targeting attacks and stereotypes and outcasting of our brothers and sisters in the Asian community, and some of the negative things ways that people have responded to them as if it's their fault. We certainly don't want to perpetuate that. It's no one's fault. It's here. We have to deal with it in the context of community, and each of us are a part of this community.
Right, I understand.
Just real quick, Chief and Councilman, just for clarification, and I want to make sure I get the councilman's question answered.
Sure.
On the dashboard, it has it broken down per zip code as well as per ward.
Zip code. I stand corrected.
Zip code, not per ward.
Right.
So
I stand corrected.
I want to make sure the councilman's question is answered. If I'm understanding his question, and he could restate it if he would like, he would like to know if council can be notified when there are cases in their specific ward. And I'll push a little further, are you able, even though it's HIPAA laws and everything, in order to reveal who in wards have been affected, or do you have breakdowns per ward? Councilman, do you want to clarify, or do you want to?
I think a step further, and thank you for that, Chair. I think a step further is I think that we're just being reactive and not being proactive, because even you don't have to give an address, but you can say, you know, this, because we're going to find out, because they're going to come. I mean, in my neighborhood, I'm going to find out, because people going to come to, hey man, you know, Uncle what's name got coronavirus, man. Okay, so there has to be a way that when we see these type of things, that we get wind of it, so that we can assist and say, hey, you know, what is the not even if it's like specific addresses, but if it's this is what we need to do in order to put to make sure that it doesn't spread. So that's one thing, Chair. I think that there needs to be a more proactive step to this, so that we can assist. And the way that we can assist is if we knew what was going on in our wards, and not just kind of hearing it like everybody else. On number two, I think the marketing has to be a lot better, and has to be a lot more aggressive. It has to be aggressive, as we're seeing, even though people are, you know, are talking down and xenophobia and talking about our Asian brothers and sisters. But the reality is that black and brown people are experiencing it more than anybody else. Mm-hmm. So how are we reaching them? How are we reaching them? With all due respect, we're not reaching them on TV 20. It's not going to happen there. We're not reaching them by the recreation centers. It's not going to happen there. That'll happen with our elders, but that's not going to happen with that 20 to 29. Social media has to be the way, and it has to be aggressive, and it has to be an aggressive people it has to be aggressive, and it has to be people are dying. And these are the numbers. We have, just like Director Gordon said that they lighten the candle, that should be on Fox 8. Today we lost another person to coronavirus. Tomorrow we done lost 2,000. Like we have to be more aggressive in our marketing. It's not aggressive enough.
Okay.
And number three, as I close, number 3 is we have something with the city where if elders if they call in, right, they can call in a specific number, and this specific number, if it automatically calls and checks up on them, right?
Yeah,
So if like, that's something that needs to be pushed right now, because honestly, I have elders in my community who are 100 something years old. I don't even know if they have it. And the problem is that many of them are isolated in their homes. So we would never even know if somebody is in their home right now dead, because we don't even know how to reach them. So along with that marketing about just Corona, we need to be being proactive. Okay, hey, listen, elders, or not even just elders, people with health conditions. Hey, call this number. As a city, we're gonna check up on you every single day. And if you don't respond, we're gonna be knocking on your door. We're gonna be reaching out to you. Matter of fact, council people, these are the people who are on the list. And at 10:25, blah blah blah, we can't reach her. We're getting ready to send somebody over there. If you want to meet us, we'll meet you over there as well. Like, we have to be proactive in our communication, because the worst thing besides the virus is that our residents feeling like nobody cares about them. Okay, nobody cares about them, and they feel left out. And we're looking at these numbers. 62% of cases that we're finding are African American or Latino, Latinas. So we see that Black and brown people are suffering more than anybody else. So we have to change our communication and how we're reaching them. And it has to be more aggressive, just as aggressive as this daggone virus is. We have to be more aggressive in our communication and making sure people know that we're here for them, that we'll be there for them, and so forth and so on. So those are my 3 acts, Chair. Number 1, we have to have a more aggressive marketing. I would like to assist with that. TV 20 is fine, but we have to look at Fox 8, Channel 3. We have to do some type of partnerships with them, that we're able to express these numbers to the city so they know what's going on. And secondly, I would like to get updates about what's happening in the city. Not just, we got 100 cases a day. Like, where at? It happened in Ward 7. Okay, well, what are we doing? What are we doing to make sure that these people are okay? Right? I need to get an update on that. I don't want to get an update just like everyone else, that I got 1,000 cases of Corona in Ward 7, and I'm just sitting here, and my residents are looking at me like, Bashir, what are you going to do? And I'm just sitting here like I'm just a person sitting in the crowd. No, I need to be a part of making the change and a part of serving my community. I have to be a part of it, okay? And I don't feel a part of it right now. I feel like I'm just in the crowd receiving information like everybody else. And that's not fair. That's not what I was elected to do. And I need to know so I can be proactive. And thirdly, we need to promote that number. And I need to get that number. If you can email it to me, please, Chair, if you can have this email to me. I need the number so that I can push for my elders and disabled, because we're not thinking about those who are hearing impaired, those who are seeing impaired, so forth and so on, who also need help, right? TV 20 needs to have captions on it, so people who are hearing and seeing impaired, how are they receiving the information right now? Excuse my passion around this, but I've received so many emails from people who are hearing impaired, right? Who don't have any information. They don't know what is going on right now, right? TV 20 needs to have somebody doing sign language while people are watching this.
Yeah.
Okay, we have Ward 7 has one of the largest populations of seeing and hearing impaired. How are we reaching them? Have they totally been forgotten? Obviously they have. TV 20, I hope you can hear me. TV 20 needs to have somebody doing sign language, okay? Because it's not just, we don't want to forget anyone during this time. We don't want anyone to feel like they've been forgotten right now. And it's so many different demographics who feel like they've been forgotten. So that's what I'm asking for, Chair. And thank you for giving me an opportunity to express it.
All right, Ms. Tilley, you have the councilman's things that he would like to be involved in. I'm going to ask if Director Gordon can follow up or directly to make sure that we plug the councilman into all of those concerns that he has, okay? I do want to make a note that
Mr. Chairman, could I just say, so I hear Councilman Jones loud and clear. I just wanted to make sure you had the phone number for the Department of Aging. It's 216-664-2833. Again, that's 216-664-2833. Thank you.
and I do want to
Can
note
you, and
that,
can you email that to me too, Director, please?
Sure thing.
and I
Thank you
do
so
want to mention that only 1%, if I'm not correct, Director, only 1% of the Asian American population are the cases right now. Is that true?
Yes, like 1.7.
All right. Next up, I have Councilman Conwell, and then I have Councilwoman Jasmine Santana. Councilman Conwell, you have the floor. Please unmute yourself.
Can you hear me, Chair?
You got some feedback and you got some static.
Can you hear me now?
Still some static, Councilman.
Hold on.
All right, go ahead. Try it again, Councilman.
All right, can you hear me now?
Yes, sir. Go ahead.
All right, thank you very, very much. I want to thank, matter of fact, Director Merrill Gordon. She sent me over the 311, the Cleveland Care Cause flyers. And my team, Mr. Chairman, dropped off 5,000 Cleveland Care Cause because Councilman Bashir Jones is right. We did street outreach with our residents so that they could register with the city of Cleveland so that we could check up on them. That Cleveland Care Cause is a great piece. I encourage every council member to reach out to Director Merrill Gordon so that we can do street outreach with our residents, and we'll drop the flyers off door to door. The other piece I want to thank you, Chairman. We had a great Saturday. You did Buckeye on the Buckeye community. My wife and I did at Eastside Market, where we test at least 300 residents for COVID-19. So we want to personally thank you for that, sir.
Thank you. Conwell. Councilwoman Conwell deserves a lot of credit too, if you don't mind me saying. Thank you.
Yeah, man. She pushed that. She pushed it all week. We did street outreach. We went door to door, talking with our residents. Here's the issue with the responders, Director, going out into the community. What I have known, and I found out that some of my residents have gone to the hospital, and they have no one to care for their pets left behind. Do we have trained disaster responders that will help as animal companions that will enter homes and feed pets at no charge?
Director?
Mr. Chairman, to the council, and that is not something I am aware of. We can certainly put an inquiry out, but I'm not aware of that at the moment.
Yeah, because you know, animals are being left behind while their loved ones are in the hospital. And you might have, let's say, a senior citizen, they have a cat, and the cat is left home alone. And here's the thing about cats. If their master is dealing with COVID-19, the cat is a high probability that they could catch the coronavirus also. And I think they should be quarantined as well for 14 days. And we should ask when we go door to door, do you have any animals? And especially cats, because if cats can carry the virus and they can pass the virus on to human beings, that's a chink in our armor, and that's a weakness in us going out door to door, through the chair to the director. Can you hear me?
Director?
I can, Mr. Chairman, to the councilman. So there has been a lot of studies on whether or not domestic animals, cats and dogs can, as we mentioned at the beginning, and maybe I didn't kind of go into it, coronaviruses are generally found in animals. They don't tend to thrive in a human host. This is this COVID-19 has, and as we know, the origins of this virus has been in animals. There have been some studies on this. I haven't read the most current ones, but it is not a pervasive thing in animals, but we have seen some studies where there have been a couple that cats that have tested positive, but they're also studying whether or not they can carry it. But like many other viruses that animals have, they don't necessarily transmit over to a human host. So we will certainly look into that as well.
But if this virus, when you look at the cause and the conditions of the virus, what spread the virus came from an animal. Is that correct? To spread over to a human being
Yeah,
in
as
China?
I said, yeah, we believe that as they're still trying to study and identify where the very first case was, they do believe that it was transmitted from an animal. And as they say, coronaviruses are not typical to human hosts, but more so to animals. And animals have a whole bunch of viruses that don't thrive in a human host. But this one, all science and researchers are and everybody looking at this believe that the origins were in an animal, perhaps a bat.
Yeah. That's what that's what I read. So when you do your survey analysis, at least ask people, do they have animals, or if this person is in the hospital who is caring for their pet. The pet could be in the house starving, or and you know what, I would suggest, and I'm going to meet with the new safety director, Kerry Howard, and we're going to talk about creating a pet hotline for people who are struggling to care for their pets because of the coronavirus. The pet hotline, what I'm looking at, it will help Clevelanders to avoid surrendering their pets, connect callers to things like subsidized emergency veterinarian medicine for their pets. Also, we're looking to create a network for free pet food pantries.
Hey, Councilman, one of the things you might want to do that I was just told, and Councilman McCormick, is aware of this as well, is that the Animal Protective League, APL, does a lot of those services. So you might want to work with them as well, because they do some of the things you're talking about as well.
Yeah, my wife told me to reach out to them as well and see how can we create some kind of systems to deal with this caring for pets left behind due to COVID-19.
Okay.
Also, through the chair to the director, switching gears on policy, the county is moving forward with regulating, helping, when my wife is pushing the legislation. I gave a policy, because I believe in policy. I believe in policy wholeheartedly. I gave a copy of the policy that I want to introduce in council to regulate gas pumps. People go to these gas pumps, hundreds of thousands of people every day. There's no way for us to wash our hands, to sanitize our hands, and then we get back into our vehicle and we contaminate our vehicle. It could be with COVID-19, it could be whatever bacterial virus. I think the high-touch areas like gas stations should be regulated, and I think that is a chink in our armor. Through the chair to the director.
Director.
Mr. Chairman, to the director, this would be something we would have to look into. I don't know, honestly, how they are. I think that weights and measures at the city under DAL, Division of Assessments and Unlicensed,
Stevens.
are the ones that do those regular inspections of the, but I would have to understand how they are regulated to begin with. But if there is a draft of the policy, as you said, at the county council level, then that would also obviously impact City of Cleveland. So it would fall under that regulation, right? For the jurisdiction. So it would be
You know
cool to
what?
see it.
Through
Hold on,
the
hold on,
chair to the director, I already reached down state to the governor's office, and they said to push it to the through the county. And I see a glitch. Here's an example. I use this pump and I have COVID-19. I touch it with my bare hands, put it back on the pump. You come in there and you use it after me. I can have the flu or whatever the case may be. You say you're not going to touch anything in your vehicle. You touch your steering wheel and you touch your other surroundings in your car. I just transferred over to you COVID-19. It's a chink in the armor, and there's a risk there, and there's a high probability at these gas pumps, and we're not looking at that. And we need to look at high touch areas as well, i.e. gas pumps. You go to use ATM machine, whatever. These are high touch areas, and with high touch areas, your odds and probabilities will go up.
Councilman,
And you know what I'm talking about, stats.
Did you introduce that policy yet? Do we have that?
The county is working on it. When the county moves forward, I'm working on it also with the city of Cleveland. I gave it over to Kimbo. I reached out to Chief Walker Minor, asked her to give me a progress review on it. With Kimbo, I have yet to get a follow-up or anything back at all. Chief Walker Minor.
Make sure that he has this progress update on that policy that he is proposing putting together. It's important for him to get that information back, okay?
Because you know what, Chief, you have to look at, like we're looking at mask and we're looking at prevention that way. Prevention is the key. So when you look at prevention, you also have to look at risk analysis. And when you say that, you say, what are my high touch areas? The gas pump, because people need to put gas in their vehicles. And you have some people that will put gloves on, and I listened to Chief Walker Minor. She's right. They'll put their gloves, but they'll touch other parts of their body. People have a right when they visit these gas pumps and they purchase gas to be safe and to hand sanitize their hands, and it doesn't cost that much. And we need to look at we need to think about all high touch areas, not just the gas pumps, ATM machines, wherever the case may be. Like Councilmember Bashir Jones said, we are at war and we got to go at these things by any means necessary, sir.
Okay.
But I need help with that, Director, and I need help to put.
Councilman, you broke up. Councilman Conwell, you broke up.
Walker Minor through the chair, are you there?
There you go, Councilman.
I'm sorry, I am here. And you're saying you sent Commissioner Kimball and myself what?
My administrative assistant forwarded to you 6 weeks ago about the legislation that I'm pushing through dealing with the gas pumps. I personally visit Commissioner Kimball and put it in his hand, and we had a conversation about the gas pumps, and he agreed with me. He said he would give me a progress review, and I said, okay. Then I reached out to you, Chief, and asked you to help me out with it to make sure that he give me a progress review. And I have nothing back at all.
Councilman, through the chair, the gas pumps are under our jurisdiction, the city of Cleveland.
So we need to look at, Chief, you're a great chief. We need to look at regulating it. You know that when it's a high touch area.
I do.
And you know that more than COVID-19 lurk at those gas pumps. All kind of bacteria, viruses, people sneeze on their hands, whatever the case may be, they get their gas, put the gas pump back up. Yeah. Councilman Conwell and his family grab the gas pump, transfer the diseases. We have to look at everything, and I yield.
Chief Director, can you guys make sure you follow up with Councilman Conwell? And Councilman Conwell, let me know when they do follow up with you so that I can make sure that you get your answer, okay?
Yeah, because Chief knows it's policy. Policy matters.
We'll get that done. We'll make sure we
You
follow
got to
up.
regulate it. And you know what,
Okay.
Mr. Chairman? Not only that we need to look at the gas pumps, we need to take a survey and do a survey analysis on all high touch areas. Not just the gas pumps, ATM machines, wherever this virus is lurking, we need to take it out. And like I mentioned earlier, even with cats, there's a probability that some cats might carry the disease. If we look at quarantining them for 14 days, that's a good thing.
Thanks, Councilman. We'll make sure we follow up. Hey,
All right, because you know, I always talk with you about policy. It's policy, policy, policy. Thank you very much.
We'll follow up. Thank you, Councilman. And I do want to thank Councilwoman Conwell and the National Council of Negro Women. I know we had 3 sites last week, and East End Neighborhood House was one of the sites, and then the East Side Market. So lots of people were able to get free tests last week, so I appreciate that. I do have Councilwoman Jasmine Santana. However, I think that she might be having a technical issue, but she has sent me a text. And the main thing that she really would like to know is to make sure that there is more diverse and grassroots communication, especially with the Hispanic community. So that's the main thing that she wants to do. She said local organizations has been helping her out with dollars and could use more dollars to help with communication. So have you put together something working specifically with the Hispanic community? And who do you have working with that outreach with Councilwoman Santana and the Hispanic community? Director?
Mr. Chairman, our outreach has been throughout the entirety of the community. I will have to check on the specifics related to anyone, but certainly we will help in any way. As we said, we have to work together on these things. And so as much as we can work with you and organizations that you recommend, we're happy to do it. Happy to provide guidance documents or any of this material that's been developed over time. As I said, all of our materials have been translated into multiple languages. I know we've worked with Global Cleveland amongst others to reach into as many communities as possible, but I don't have right here at my fingertips exactly which ones in Councilwoman Santana's community, but we will work with anyone and everyone. It only works that way, and that's the only way we're going to reach and continue to reach. So initially, I think, people were taking it very seriously, but as this is a duration, this is a marathon, this is many marathons. And so, we've tried to update all of our materials as well so that it's not stagnant. And we're trying to kind of redeploy some of our messaging in different ways to continue to get people's attention so that these very simple messages of do not go out unless it's necessary. Cover your nose and mouth with a face covering, and washing your hands with soap and water.
All right, Councilwoman Santana really feels like the Latino communities are feeling left out when it comes to having the latest information. And what she would recommend is that within at least 24 hours of something happening, that there is a dedicated outreach to the Hispanic community. So if there's an update in orders from the governor, an update in other type of policies, she's recommending that, some kind of way that it be the Hispanic community and her especially is notified within 24 hours. What I would recommend is that, maybe you spend some time with her to help get some ideas about how to communicate with the Hispanic community, as well as talk with some of our networks. I know you've done a good job of talking with some of the Hispanic leaders, Director, but please make sure that you keep Councilwoman Santana in the loop on that, okay?
Certainly, certainly.
All right. I apologize, she can't get on right now. Her computer is having a technical issue, but she did send me those questions to ask.
The
With
whole
that
other
being
issue in our
said,
community too is access to broadband, right? So we understand that as well. Okay, yep.
I now have Councilwoman Phyllis Cleveland. If Councilwoman Cleveland, you have the floor. Councilman Conwell, did you have your hand back up again? I got Councilwoman Cleveland.
Yes. I just wanted to say one thing. Chairman, can you hear me?
Yeah, I got Councilwoman Cleveland. Can I come back to you, Councilman Conwell, because I can't hear.
All right, cool beans. Thank you.
Councilwoman Cleveland, go.
Good morning, Mr. Chair. Thank you, Councilman Conwell. To the chair and to all who are listening to this broadcast, I just wanted to give a shout out, but also just to make the information available of another testing site. And that is one of our FQHC's federally qualified healthcare centers, Care Alliance at 2916 Central Avenue. That's at the corner of East 30th and Central. And they are actually doing drive-up testing Mondays, Wednesdays, and Fridays from 11 to 4. And you do have to call ahead to register. And let me get that number real quick. The number is 216-535-9100 and press number 6. That's 216-535-9100, press number 6. And this is again to register for drive-through testing, drive-through COVID-19 testing at Care Alliance at East 30th and Central. They have a real organized system set up once you registered, and we've got the streets, designated areas of the street blocked out just for that purpose. And this is going to continue at least through, I believe, through the end of August. So I just wanted to make people aware of that, Care Alliance as a testing site. And they also do testing inside the clinic as well. You can call the same number. Thank you, Mr. Chair.
Thank you so much, Councilwoman Cleveland. Councilman Conwell.
To the chair, to Councilwoman Cleveland, can she give me a copy of the flyer that she narrated to us? As you know, I walk my neighborhood, and I will drop that door to door to my residents.
I will share that with everyone. Thank you.
Okay, because I need that. Just as a statement, Councilmember Bashir Jones is right. I remember, Mr. Chairman, legislating Cleveland Care Calls back in 2008. We need to push that more than ever. I need your leadership on that, to have every council member to push out Cleveland Care Calls so that so our residents will get up-to-date information on what's going on in the city. Cleveland Care Calls is a untold story, man. It's a beautiful piece. That's all I want to say for that. Thank you.
All right. I did have one miscellaneous, and I do want to be cognizant that everybody, we're about 2.5 hours into this meeting. I know I don't do health committee meetings as frequent as we usually do. And this is why this meeting is run a little longer, because this is a very important topic. But I will allow one miscellaneous for Councilman Joe Jones. He had one miscellaneous for a house cleaning item. I will ask that we are cognizant because the director and her team do have to get back to doing the business of administering this crisis. Councilman Joe Jones, you have the floor. Please unmute yourself, Councilman Jones.
Mr. Chairman, I know that the director is very busy with handling the COVID virus and that kind of thing. The question I would have is, how are we doing with our complaints? Because I have a number of complaints in my neighborhood. One being the Hayes House on Harvard Avenue. I know that my code enforcement people have turned that in to not only the city of Cleveland, but also to the health department, because a number of junk vehicles that are in the property. It's on our main strip. It makes our neighborhood look bad. And Mr. Chairman, we have a number of properties throughout our neighborhood where we have a lot of junk vehicles, or we have properties where people are, I guess the best word, I don't know what the appropriate word to say. I won't say pack rats, but they have a lot of debris, almost creating junkyard scenarios in residential zones. And then in just the basic commercial areas, we're not getting the service we need from our inspectors in terms of citing people. And so I don't know what's going on in my neighborhood, but if the director could sort of kind of, work with me, versus this being one of those things of going back and forth kind of scenario. I need to know who are the people that are assigned to this neighborhood, meet them and let them know what our expectations are in our community, because right now we're going we're moving in the wrong direction in terms of health and safety issues in our community, and we're not being serviced, and it doesn't seem like the department is taking these issues serious. And so, and that's because of how lethargically slow these processes are going. And I probably presume some of that would mean would probably be brought up on the coronavirus scenario. But Mr. Chairman, before the coronavirus, we still had a lethargic process of waiting to get things done, or inspector coming out and inspecting and doing the kind of work that he or she needs to do as it relates to the health department. So I need some help out here.
So Director, can you
Chairman, to the director.
Director, one
Yeah.
second. If you could, because this seems like it's something that you, once again, I want to make sure that we stick to broad budget or operational issues. What I think Councilman Jones is asking you for is really an in-depth, detailed briefing about who are assigned to this neighborhood. And I don't want to just try to give it a snapshot answer in this setting.
That's right.
Could you please just make sure that you have someone to sit down or call him to go over this in detail so that he can have somebody to work with out there from the health department? Does that suffice for you, Councilman Jones?
That, Mr. Chairman, I think that you were wonderful in how you expressed it to the director. This is not a quick snap issue. This is the saving of a neighborhood that has been long neglected in terms of safety issues, health issues on a number of levels. And I don't have a problem with even meeting the director out here, letting her see some of the issues that I'm dealing with and confronted with on a daily basis that we've turned in, not one time, but several times, not several times, but multiple times, almost 20 sometimes, and we still have the same issues. And it seems like, I don't know if it's a communication issue. I don't know if I just don't know what to say other than how can we continue to be sitting here with this similar issue or same issue year in and year out, and we just can't seem to get it resolved. So I'm in the factor right now, Mr. Chairman, spending $50,000 on a crew just to go and pick up paper where it needs to be picked up, and debris, dead animals, and all the sort that are just not being addressed by the city services.
All right, Councilman, I'll make sure that we'll follow up with that because I want to make sure that we do that. Director, go.
Mr. Chairman, I just wanted to say one thing on that. So our health inspectors have been out, especially our local code enforcement. This has been a real challenging time, as everyone knows, because the courts have been closed. So to get things through the enforcement process requires the courts to be open. So there have been inspections, continuous inspections. Our staff has been out there. I really just, again, want to give a shout out to the entire CDH team. We know that there have been some delays with bulk pickup and a few other things that are now back on schedule. So this all contributed to some of the challenges I know you all and your community have faced. So we just want to acknowledge and really, again, appreciate everybody's effort on all of this. But it's not for lack of not going out, not for lack of not inspecting. It's just the entirety of a process. So I just wanted to make sure that I put that out with that background.
And Mr. Chairman, I appreciate the response of the director, but this is a issue, Mr. Chairman, that predates the coronavirus. So it's the same scenario. So I've gotten to a space where, moving forward, I don't want to wear the jacket of somebody else's responsibility. And so when it comes to the issues that I'm handling, it'd probably be best to have the director come out with me to my neighborhood so that she and her team can see what my challenges are. And then maybe her team can work with my team to really begin the process to strategically, surgically go in and deal with some of these chronic issues and these repeat offenders that are continuing to make our city look bad and bring our neighborhood down. And if we continue this route, we'll continue losing Clevelanders who can go to cities and provide and offer better services.
All right, Director, so you're going to follow up with Councilman Jones on all his issues, right? Okay. Councilman Jones, thank you so much for bringing that up. Ladies and gentlemen, it's been a 2.5-hour meeting, and I do want to be respectful of everybody's time. Councilman Jones, I know you're going to follow up with Director Gordon. If you need me to help out with that, let me know. Give me a call or text. But Director, I just want to reiterate to you and your team, we do appreciate the hard work that has gone into this. Council wants to be a part of the solution. So put everybody to work. Everybody has signed up and said that they want to be helpful. So find a way to sign up. I do want to make sure, if you could, because with Councilman Bashir Jones asked some questions earlier, and I want to make sure that we give some clarification. Some things are privacy related and some things we can disclose. And I don't know if we gave if you gave the background on what is able to be given out and what is public, and then what is private. And I think that we need to really make that clarification so that we don't have any confusion about what accessibility people have, because also Councilman Polinsky has made that request in the past as well. But thank you to you and your team. And thank you to, for handling this unprecedented crisis in our community. And all I could say is let's continue to stay home, wash our hands, and what else? Stay 6 feet away, physical distancing, right?
Physical distance, yes, thank you.
And also wear that face mask.
Face mask, over both the nose and mouth.
That's right.
Appreciate it. Thanks, everybody. You guys have a great day, and appreciate everybody. This Committee of Health and Human Services is adjourned, and we look forward to talking to you next time. Thank you.
Thank you, Mr. Chairman. Thank you, Director.